Hi, doctor. I have some important information on an exciting new program that will improve patient retention past the point of pain relief, allow you to get even better clinical outcomes with chiropractic patients, and boost your practice's bottom line. This approach is really about making very minor changes to yield very significant results in your practice and your patient outcomes. As I'm sure you know, the biggest challenge to practitioners these days is the loss of patients before their care is complete. Unfortunately, patients often quit care when their discomfort resolves, but before their bodies are fully healed. Here's a diagram showing the typical stopping point of a patient, and as we know, stopping care too early may lead to such additional challenges as an increased risk of re-injury. So now you can keep your patients on track with a system that complements your current chiropractic care. It's the new 3 Phases of Care program. The 3 Phases of Care is a convenient, cost-effective, and profitable complement to your practice. It helps you to educate and retain your patients. It integrates seamlessly into what you're already doing, and it provides you with a profit center, which is substantial, as well as being a simple system that only uses 3 easy products. The 3 Phases of Care introduces patients to the powerful synergy of chiropractic care and nutrition, from the acute phase to the subacute phase to ongoing wellness, pairing together chiropractic and specific nutraceuticals for each phase. And the program comes with these great tools to help you walk your patient step by step through the program, from beautiful patient brochures to protocol sheets for the patient so they understand how to go through the program and what dosages to take, and also a great new laminated piece. Here, check this out. If you're tired of patients discontinuing care when their pain is gone, but before they're fully healed, then I've got a patient communication tool that you're going to love. It's the 3 Phases of Care laminated mini poster. A conversation with your patients goes something like this. Hi Marion, let me show you this chart. It's a graphic representation of how we're going to get you better. The fastest way to get you to a state of wellness is to treat you in 3 different phases. The first phase is the acute phase, and it lasts for 3 to 5 days after your injury. The second phase is the subacute phase. It lasts about 6 to 8 weeks. This is the phase where most of your healing occurs. After that phase, we can really focus on optimal health and vitality because you've made it to the 3rd phase, or the wellness phase. But for right now, we're going to start with phase 1 and focus on reducing pain, spasm, and swelling with regular chiropractic care and a targeted nutraceutical that contains safe and effective natural substances. In about 2 to 3 weeks, you'll probably be coming to what's known as a decision point in your therapy. Your pain will be almost gone, but if you choose to discontinue your care before your injury is fully healed, you'll have a significantly higher risk of re-injury in the near future. This is of course your decision, but I would recommend you continue care at least until your injury is fully healed. During the healing process, we'll improve your range of motion and function with chiropractic care and a targeted nutraceutical to promote faster healing. When you've reached the wellness phase, we'll promote optimal health and vitality with less frequent but regular chiropractic care and a targeted nutraceutical for wellness. It's different from most other wellness supplements because my patients really feel the difference. This laminated piece is so simple to integrate into your current system and such an effective way to improve patient compliance. As a matter of fact, this entire turnkey program incorporates itself seamlessly into your practice. All we ask is that you make minor changes to yield significant results. Here, take a look. You're doing your patient exam? Do it the same way. You report of findings, and when you recommend a treatment plan, introduce the 3 Phases of Care, utilizing these great high-compliance tools. You provide your therapy, and you recommend just 1 supplement and dispense it to the patient. In the acute phase, it's an easy point of entry for your patients. It's phase 1, and it lasts for approximately 72 hours. So it's just a bottle of 9 packets. You take 1 packet 3 times a day, and it contains all the nutraceuticals necessary to help your patients through the issues of that phase. The proven natural substances in the acute phase formula include boswellia, as well as turmeric, ginger, cayenne, and quercetin, and they've all been shown in studies to be helpful for minor pain. The Phase 1 formula also supplies important minerals involved in muscular contraction and relaxation, essential for that period of time during the acute phase. And lastly, it has proteolytic enzymes in it, which have been shown to improve lymphatic drainage. In Phase 2 of the patient's care, you'll introduce nutrients that support the health of tendons, ligaments, and cartilage. The supplement EC Matrix truly supports healthy tissue remodeling according to research. This supplement works by modulating the enzymes that degrade collagen. These MMP enzymes, or matrix metalloproteinase enzymes, are released from the chondrocyte in response to injury or inflammation. Their job is to be able to break down damaged collagen so you can put down good, straight, and parallel strands of collagen. Unfortunately, these MMP enzymes can become overzealous and a little overactive. They'll break down not only the unhealthy and damaged collagen, but also the healthy tissue as well. This is due to such things as systemic inflammation, improper diet, and lifestyle issues. So with this in mind, you want to be able to modulate the expression of these MMP enzymes to support a healthier remodeling of connective tissue, and that's where EC Matrix comes in. Here, check out the outcomes of this multi-site evaluation. They used EC Matrix with 12 difficult patients where previous care had only been mildly helpful. I mean, these are not the folks in your front brag book there. These are the patients that you do everything right with, and they still don't get better. Well, let's take a look at the outcomes. First, the average initial discomfort scores before the EC Matrix were a 7 out of 10, 10 being the highest. The average initial flexibility scores was a score of 3, with 10 being the most flexible. These folks weren't touching their toes. And within just 24 hours after taking the EC Matrix, they had a 70% improvement in discomfort and a 50% improvement in flexibility. That's pretty impressive, wouldn't you say? Then in the next and last phase, which is Phase 3, the wellness phase, you offer them Wellness Essentials. It's a convenient packeted formula that really supports daily wellness, containing a great multi that people really feel the difference with, and EPA DHAs providing your patients with those highly researched fish oils, and Advocare, which is a great antioxidant and detoxification formula. It's a great approach with high compliance. So it's pretty plain to see that the 3 phases of care is a simple and effective program for all your patients who've either recently injured or re-injured themselves. And that's not to mention the fact that it provides a significant source of additional revenue to your practice. By beginning just 5 patients per week, that's just 1 a day, it'll increase your annual practice revenue by over $122,000. So just as a recap, when you introduce your patients to the 3 phases of care program, you help to educate and retain them. You also help to get better clinical outcomes with chiropractic patients, and it also provides your practice with a significant additional profit center. So we at Metagenics have made it simple for you to start recommending the 3 phases of care to your patients today, and here's how. With the Chiropac 1 offer, you'll get all of the tools needed to be able to start the program in your practice immediately. You'll also receive a 5% discount on your order. And you get all of this for free when you purchase enough of the supplements for 2 patients. That's just 2 of the Phase 1 supplements, 2 of the Phase 2 supplements, and 2 of the Phase 3 supplements. In total, that's $159.46 before the discount. With the Chiropac 2 offer, you'll receive 3 times the discount. That's a 15% discount, nearly a $60 savings. You'll also receive a larger supply of all the tools needed to be able to implement the 3 phases of care in your practice. And you'll receive all of that for free with just enough supplements for 5 patients, coming out to $398.65 before the 15% discount. So doctor, which do you think would be better for your practice? Chiropac 1 or Chiropac 2?